Good morning, everyone, and welcome to the Black Health Agenda in San Joaquin County. Thank you all for agreeing to participate and joining us today in what we hope to be a really significant and monumental event for San Joaquin County as well as the California Black Health Network. I am Rhonda Smith, the Executive Director of the California Black Health Network, and we have a lot in store for everyone today and looking forward to learning a lot from you as well. So before we begin, I want to take a minute to acknowledge Black History Month. And this is particularly significant doing this event on this day in Black History Month because we have a lot to, I think, be thankful and proud of. But I think one of the things that, and the reasons why we're here is because life expectancy for Black Californians is about 5.5 years less. So before COVID, that was the case. Because of COVID now, there is about another year to 2 years of gap in life expectancy for Black Californians, but we are working to change that. So part of the reason why we're here today is to learn from you and collaborate with you and work with you to determine what we need to do to close the gap in health disparities and improve life expectancy for all Black Californians. So we are working to rewrite our health history and love for you to be part of that process.
So we're going to go ahead and transition to our next guest in our next conversation portion, which is going to be Black maternal health. And our special guest in this area is Anna. And so Dr. Anna Malaika Tubbs is a multidisciplinary expert on current and historical understanding of race, gender, and equity. After graduating Phi Beta Kappa from Stanford University with a BA in anthropology, Anna earned her master's in gender studies and her PhD in sociology from the University of Cambridge as a Bill and Melinda Gates Cambridge Scholar. She is the author of the New York Times best-selling book, The Three Mothers: How the Mothers of Martin Luther King Jr., Malcolm X, and James Baldwin Shaped a Nation. Anna lives with her husband, Michael Tubbs, our former mayor, yes, go, Michael, and their children, Micah, Malaika, and Nehemiah Nevin. And so welcome, Anna.
Thank you for having me. Hi, everybody. Hope everyone's enjoying everything so far.
So today we are going to be talking about Black maternal health. And so can you, before we even dive into questions, Black maternal health, like what is that?
Yeah, it's an important question because we say it so often, and I think a lot of people aren't fully aware how we should define it. And there may be people who define it a little differently, but this is how I do. Anything that surrounds the birthing experiences of Black birthing parents. So anything that has to do with our reproductive health, whether that's thinking even early on about access to birth control. This is a part of maternal health as well, whether you have the choice to become a parent or not. And then speaking further into the process around biases we might meet when we go to see doctors and healthcare providers, or having access to midwives and doulas, or will our voices be heard when we're in labor and delivery? Will we be taken care of postpartum? And for a lot of people, they'll say postpartum is, every year after you have your child is postpartum, because you're also, as a mother, thinking about what's going on with your child when they're outside of your home. So it's a wide range of speaking about the care that we're taking for Black birthing parents.
Is this Black maternal health and the disparities that we're talking about? So is there a vast difference that you see in the disparities with Black mothers that when it comes to maternal health than other cultures or races?
Absolutely. So that would get us into what we say when we're talking about the Black maternal health crisis more specifically. So when we say there is a crisis, the reason we use this term is because Black mothers are more likely to die, not only in pregnancy, but also in childbirth. We know that Black children are more likely to pass away as well. And there are a lot of factors that contribute to this. And some might say that it's because there's a lot of health disparities within our community, but that, I would argue, all comes back to discriminatory practices against our community that have kept us from having access to the resources that we deserve. So even for me, having gone, and had 2 children now. I had one in a hospital and one I did with a home birth with a midwife. I had doulas around me when I was in the hospital. So I was really fortunate to have the privilege to be able to have other women of color around me in my entire process of being pregnant and through my labor and through delivery, as well as postpartum, for them to check in on me and to advise me with nursing, etc. But most of us do not have access to that. And so we go into these systems that have been built really on experimenting on the bodies of Black women, very specifically with American gynecology. Things like a C-section and more have been perfected by experimenting on the bodies of women who were enslaved, Black women who were enslaved. And so a system that was built in this way, that already thought of us as if we were less than human, as if we could be experimented on, that bias is still very present in how we are treated when we go into hospitals today. And unfortunately, a lot of us are not aware of that. And so we trust that we can go to a hospital and be okay and be taken care of and be respected. And it's not until we're on the other end of things that we realize that certain things might have been done that shouldn't have ever happened, or something wasn't explained to us fully, or in this moment of vulnerability when you're taking care of a child and you're birthing a child, and maybe if you've never done this before, especially in those moments, you're not being heard and you feel like you have to just go with what the experts are telling you. And that is when a lot of people are now realizing that should not have gone the way that it did. What is happening? How did this come as a result? Even we see this happen with Beyonce and Serena Williams. Some of the most influential people in our world have spoken about the fact that no one was listening to them, and they had to advocate for themselves, or they could have died in childbirth. So this is the Black maternal health crisis. When we say this word to follow that kind of general understanding of Black maternal health, it's because of that.
Okay, so man, this is I'm just taking all of this in because like I said, I'm in a space, and as I'm hearing this information as a community organizer, I promise you, you guys are like, it's triggering, and I'm being disrupted because we need to advocate now on a deeper level. When you mentioned in regard to, you pointed to historically that they used to experiment on Black women, and almost alluding to the fact that in some ways they probably still do. However, I want to now go through a historical timeline, and I want to point it to the book that you did research on and you wrote. What's the connection with Black maternal health, the Black maternal health crisis, and the book that you authored that is featuring the 3 mothers of our leaders in our community?
Yeah, so the book is about Alberta King, Bertus Baldwin, and Louise Little, the mothers of the men that we've mentioned. And I wanted to write it because so often when we as a Black community say we are being treated as less than human, others might say, oh, that's dramatic, that's not really happening. They try to discredit our experiences, but nowhere is it more apparent and obvious, this dehumanizing treatment, than when we look at Black mothers and the treatment of them in the United States throughout American history. So we are the only group that, even by law, it was stated that we were the givers of non-life. So through our children, we were the givers of property. This was written in law. Woo. And if you don't believe that is dehumanizing, that is the exact definition of treating a human being as if they are not a human being. And so Black mothers are so aware of this dehumanizing treatment. And more importantly, we have fought to make sure that the world and our country sees us as the human beings who we know we are, see our children as the human beings that we know they are, full of they deserve that dignity and respect, just like anybody else does. And so this is why I wanted to study that. Very specifically, I wanted to highlight Black mothers and our resistance and the ways in which we've given life, even when that has been denied to us. So not only through birthing our children, but through birthing our projects, our creativity, our activism. We have pushed this nation in so many incredible ways, and it's time that we honor that. But in doing that research, it gave me a very deep understanding of the dangers of Black motherhood in the United States, and going all the way back to slavery and speaking about experimenting on the bodies of enslaved women, and gynecologists that are still celebrated to this day, when in fact they were very evil and were cutting open into the bodies of women who were laboring and were trying to bring their children into this world. For many, many years, it wasn't allowed for us to even deliver in hospitals. It was illegal for us to try and deliver our children in hospitals. And so we had a wonderful, respected practice of granny midwives in Black communities. And then when Medicaid is introduced, which is something that we wanted, we definitely did want this. However, it was used against Black women in ways where they were then forced to go into the hospital. And granny midwives are told, you are dirty, you don't know what you're doing, you're inexperienced. And Black women who wanted to deliver in this traditional way were judged for doing so. Because if they could deliver in hospitals, hospitals could make money off of us delivering in hospitals. So I'm not saying that there's anything wrong with us delivering in hospitals. What I am saying is that there is a history behind it that we have to be informed about and well aware of, so that we know that any options that are being given to us, there's actually also money behind that. You know, there's more money behind an epidural, there's more money behind a C-section. And so quite often, especially for women who are uninformed on the history of this, we make decisions that we didn't realize were a part of something much larger, in a system that was really built on taking away our rights, taking away our humanity, taking away our freedoms. So that is how we've kind of arrived at this point today. But when I was writing the book, I also found myself expecting Malachi, our firstborn. And because I was so aware of how dangerous and how scary all this could be, I really leaned on the stories of these three women to find strength and to find and remember that I had agency, that this was not some inevitable burden that I was going to have to carry as a Black woman and as a Black mother, but that I could really still hold on to my joy and my love and that revolutionary power of Black maternal love and joy, because it was crucial to our fight. To still be excited, to still celebrate the life that I was bringing to this world, and to not be dictated and controlled by the fear. And instead to use my knowledge to not only advocate for myself, not only to seek doulas and to seek midwives, but to also make sure that this was something that we could change on a systemic level. We need more access to doulas and midwives. That should be covered by insurance. It shouldn't be only available to the few that can afford it, and the privileged few that can afford it. And there's so many other policies that follow with this. We need access to affordable childcare. We need access to parental leave, and all of these things that we know are even worse for Black women in the United States because they're not made available to us.
So I wanted to ask you a really quick question in that area. When it came to you seeking out a doula, what was that experience like for you in the San Joaquin County? Because you were here.
It was difficult. It was a lot easier the second time with Nehemiah. We'd moved to LA and there was more available, but still, there are not many doulas of color. There are not many midwives of color, because even the access to that training, because it's so separate of insurance or degrees that could be paid for through scholarship, et cetera, even then it's hard for Black women and Latinx women to become doulas and become midwives and to receive that training. And so I was shocked that within Stockton, I couldn't find a midwife of color. I wanted to do a home birth with Malachi. And so I had to reach out to contacts in the Bay. So my doulas actually traveled in from Oakland. They were willing to drive an hour and a half from Oakland, two Black women who were just willing to do it for me. Of course, yes, we were paying them to do that, but even the fact that they said, okay, we will, it's important to us that you have this experience of what you have envisioned for your labor, and that you have someone who's going to advocate for you throughout your pregnancy, as well as when you're in the hospital. And I can say hands down, because they were there with me, my experience was a beautiful one, but it could have been very different without them.
Wow.
And then when we moved to LA, I had more access to options. And I actually want to come back and say that I also couldn't find any doulas who spoke Spanish that were within, closest to Stockton, which is really crazy, because of course we know we have such a beautiful and large Latinx community, there should be birth workers who can speak the same language as the women who are seeking their assistance. And that was really shocking for me and something that needs to be corrected.
Wow, I really appreciate you lifting that up because that's very startling. And even as a plug, I seen it in the chat. Flourishing Families, Tamisha Valverde and Erica Dorsey, they have a program that gives access to doulas as well. And I know that when we break out in the afternoon session, that they'll be lifting up some of that information and have further discussion about that. I want to transition us to some Q&A that is coming in. Right before I ask the last question, well, no, let me do it. I'm going to ask this question that's coming in the chat. Is there are there any solutions that you're aware of to having more Black OBGYNs here in the San Joaquin County in particular?
Is the question, I mean, we need to clarify a little bit. Is it that if we had more Black OBGYNs, this would help with the Black maternal health crisis?
Yeah, is that the solution? Yes.
Yeah, I do think that's definitely a part of it. We see that, for instance, in places like the UK, where there is access to healthcare for everyone, even then they also provide access to midwives for mothers. Even then, there is still this disparity where Black women are more likely to die in pregnancy and in childbirth. So it has a lot more to do with the person who is there caring for you. And if they are a woman of color, this will make a huge difference. Research shows that having that advocacy where it's another woman of color who is going to hear you, who is not going to see you as someone who can somehow withstand more pain, which is often how Black women are represented and seen.
Yes.
So when they say something's wrong, people think, okay, we can deal with her later. But instead, if it's somebody who sees you as the human being who you are, because they see themselves that way, that can make a huge difference as well.
Mm-hmm. Oh yeah. Having 4 children, I tell you, and I had no idea that some of the things that I was experiencing, crowning it was time. I told them they gave me a bedpan first child. I had no idea. So there was no knowledge in my mind that what they were doing was wrong, and they weren't paying attention. It took my doctor coming in, to say, hey, she's ready to push. What's going on, and to correct it. But the nurses entreated me as though I had no clue what my body was instinctively telling me to do. So, yeah, this is really a profound issue, and it is a crisis. One more question: what specific problems in maternal health do you notice, or did you notice in the San Joaquin County?
I mean, we touched upon some of them. I would say when we did the report on the status of women, we found that there was not an equal access to even reproductive health care. So it was difficult for women of color to access the same options when it comes to birth control if they wanted to. It was difficult for them to find providers who looked like them and had similar experiences, or who would treat them the way they wanted to be treated when they sought care. It was difficult to find doulas and to find midwives, or to find people who spoke their same language. So all of these factors are contributing to Black women feeling like they're out there on their own when they're trying to bring their children into this world. So it exists on every level, even before you try to have a child, while you're pregnant, going into the hospital to deliver, and then even being able to come back for access. There's not a lot of insurance. There is not, everyone isn't covered equally. And so these were some of the major difficulties for Black women in San Joaquin.
So I have 2 more questions. One is me as a community organizer and advocate, and a lot of people in this space are advocates as well, for the young ladies, for our young Black queens that are coming up. How do we advocate for them? What are some things that come to mind, Anna, that you would lift up to us, that we can do better in order to make these changes that need to be made in our community?
This is difficult because I really think as Black women, we have been doing and are continuing to do so much of the work that I think it really falls more on larger systems and others who are not Black women themselves. We already have so much on our shoulders. So I'm not going to be someone who says Black women take up more and take on more pressure. I want us to be able to rest a little bit. I need other people to do their part. They're part of this responsibility. We even saw, and it's a hard thing to talk about, but the numbers of domestic violence were incredibly high in Stockton, and especially for women of color, especially for Black women. So it's even within our community, we need to not stand back and say, great job, Black women, you're so strong, keep holding us all up. No, we need to turn that admiration into action. We need to support Black women. We need to listen to them. We need to elect Black women. We need to support our elected Black women and stand by them. We need to listen to their vision for what's possible for our community. And on a national level, we need to be able to have universal parental leave. We need to think about affordable quality childcare, and not just for those who, again, have the privilege of knowing where to go. It should be available to all of us. And as I've mentioned already, that midwives and doulas should be covered. And the list goes on and on and on. But I will say that it's not that Black women need to do anything else. We need other people to do the work, do their part finally.
Oh, I had to sit back in my seat. Look, and I'm trying not to go. I had to sit back in my seat when you said that, because we do advocate fiercely.
And we're always willing to do the work is the thing. That's why, of course we ask that. We say, well, what else can we do? Because we will continue to do the work. It's time for other people to do your part.
Step up. Wow. So I was going to ask, is there anything else that you would want to say to Black mothers in this audience today? Other than, because you just checked me. I'm like, I need a tissue. I felt hugged in the heart when you said that.
I see you. I see all the work that you're doing. I would say that in studying the women that I studied in my book, the incredible mothers of these giants who had really not received the recognition that they deserved and the celebration that they deserved, that for us, the only thing I want us to do more of is to stand in the light, tell our stories, and make sure people know what we have done, and that we not be in the background any longer, that we not be disrespected, but that we say, here's who I am and here is my story. And especially when it comes to very specifically this conversation around Black maternal health and the Black maternal health crisis, experiences that we've been through, we shouldn't feel ashamed that something happened to us. We need to call out those systems and feel okay with sharing some of these moments, because like you said, for women who are new to mothering, like I am, who are maybe thinking about becoming mothers, it's helpful for us to know we need these tools so that we can fight against it. So sharing our story, being proud of that, proud of our contributions, and not being okay with being erased from the narrative.
Oh my God, not being okay with it. That's going to be my sentence. I do a sentence a day, and that's going to be my sentence. I have to not be okay with being erased from the narrative. That was profound. So we are going to be transitioning to break here in a few minutes, and I don't have another question in the queue. And there was something that did come to mind. I'm trying to bring it back. Mental health. Our next conversation is going to be around mental health. So I'm going to ask you a question just to kind of kick us off into that section after our break. How does this Black maternal health, this crisis that we're in, how do you see that impact Black women's mental health?
I'll say this, that the Black maternal health crisis that we're speaking about here is not separate from everything else that we're talking about today. It is intertwined with our fight for freedom and our fight for social justice. It is a fight against dehumanization. It is a fight against the many ways in which we're being robbed of our humanity. And one thing that we hadn't mentioned quite yet, but that is so critical, is that these attacks against Black lives have also happened through forced sterilization or robbing Black women of the ability to have children if they want to. This is a fight that all of us need to take on and pay attention to. So when it comes to mental health, of course, it is inextricably linked to thinking about how we're being treated and seen from the moment we are in our mother's wombs. That fight begins that early in terms of an attack, not only on our bodies, but on our minds. And so when we're aware that we're seen as less than human, that's going to impact our ability to do anything if the access to those things is not available to us, if we're not treated with dignity, if we're not treated with respect. So if there's one thing that I want us to walk away with from this discussion, is that we all need to pay attention to Black maternal health. It is not only Black women who should be concerned about this, but every single one of us. This is where the fight often begins. And you cannot say you are a champion for our rights if you're not paying attention to this fight right here. So 100% it is linked to mental health, and it is a painful one to realize that we are going to be treated this way in this country, but to remind ourselves of the power that Black mothers have reminded us that we have, and the agency that we have, and how important it is to find the resources and ask for the help, and be okay with saying I'm not okay, in order for us to reclaim that joy, because that happiness is revolutionary and it's probably our most powerful tool.
Anna, man, the work that you're doing, you're not just an author. You are doing some profound work. Your voice is very maternal. I just so appreciate you. I applaud you. And I pray that God would just really pour back into you all the virtue that you are pouring out to the community on behalf of all of the women, and that He gives your voice a huge resound megaphone so that others will step up too. Thank you so much for being with us today.
Thank you, everyone.